So do you see the potential for consumer data, consumer engagement to change because of how there's retail channels now associated with payer channels?
I think that's a really interesting question, and I don't know exactly, because one of the barriers that with a lot of the payers is the amount of time that they assume somebody will be theirs to manage is pretty short. And if they're commercial, then the insurance company is, they're administering the program, but they're not necessarily taking the risk for the person. And so the combination of those things, I think has historically made it kind of challenging for the payers to see, real short-term kind of economic benefits from a lot of the solutions that otherwise would make sense if they were, much more, if they had people for a much longer period of time and had the risk of those people for a much longer period of time. I think there are some of the insurance companies and a lot of experiments that are kind of with this transition, if that's what it's called, to value-based care, will get stronger and stronger and stronger. And then I think this integration with consumer platforms is potentially really quite interesting.
And I kind of wonder too if the insurance model is changing. So if you look at some of the recent kind of C-level hires at a United or a Cigna or an Aetna, Aetna certainly, Steve Edelman now is the new chief marketing officer. And if you look at his background and work that he's done for lifetime value during his time at McKinsey with the butterfly chart, I kind of wonder if the insurance industry is moving towards thinking about how they retain folks, because consumerization is kind of entering healthcare, versus just holding somebody for a year or two and knowing that they're going to switch jobs or their employer is going to change, and how the member retention and how insurance companies are really focused on that now will create new opportunities.
Yeah, that's a really interesting point. And I think I have heard several companies talk about, not exactly in these words, but they want to make their products stickier, and they want to have their brand be something that people want to stick with or want to seek out, because they want their brand to mean something more than it has historically. I do think that's an interesting.
Yeah, we actually saw that in the product that I worked on at Everyday Health. We built a solution that connected women to insurance benefits that they would have when they were pregnant. So EH owned the digital rights to what to expect when you're expecting, so we had access to 58% all pregnant women in the country. And we would send out emails for Cigna to let them know about pregnancy benefits that were available to them. And a lot of people said, oh, people don't trust payers. But it turned out that we would get 48% open rates on those emails and like 30% click-through rates, which are outstanding for digital marketing campaigns, right? So I think that there actually is an opportunity to leverage those brands because they are trusted if they're positioned in the right way.
Well, and probably you were delivering content that was relevant.
Exactly.
And timely. So did Everyday Health buy What to Expect? Or did they?
It was a licensing partnership with the Mercovs. So the way that company kind of started was they got the South Beach diet and the licensing rights, digital licensing rights to that, and What to Expect when you're expecting. And they were just in the right place at the right time and created some great products around those two brands. And that allowed them to get access to data for millions of consumers a month, which is then what drove the algorithms to drive ROI-based digital banners. And then we're the first in the industry that really could prove that seeing a banner on one of our properties led to script lift within the doctor's office. So it was a whole big data play. It was interesting.
Yeah, well, as a parent of a 3-month-old, I'm very familiar with the What to Expect app and content that comes out from that.
It's interesting. I mean, one of the things that leads to stickiness within that is the affinity that women have to one another with, and I'm sure your wife went through this, being in a message board with women who share your due date, or due month, I should say, and that shared experience you have over that 9 or 10 month period is really powerful. And lots of people talk about how do you introduce community into digital healthcare products. And the challenge is you need to have affinity beyond just the disease. And you really need to find how to connect people who are struggling with the same things you are that there's really shared empathy between those audiences. And I think pregnancy is a great example because it's one of the few happy healthcare events.
Yeah, right.
It's kind of like a happy 10-month chronic condition.
Yeah.
And it's a shared experience, and really what you go through in month 1 and month 2 as a woman, and what the husbands are doing, right, and being able to talk and discuss with that and engage each other in courses of care, it was really one of the valuable lessons that I had working at EH. And it's hard to figure out what that system looks like for something like diabetes or something like some of the other chronic conditions that people are facing.